Hey, it's Dr. Neuhaus. I want to talk to you about a problem we call crossover toe. It's not very common, but it's a deformity typically in the second toe of the foot, where the second toe will start to curl up and rise up over the top of the big toe. Sometimes this is associated with a bunion, and the big toe will start to shift over in a bunion and actually push underneath the second toe, causing the deformity to occur. However, oftentimes people will say, they'll come into the office, they'll see me say, hey, my toes are starting to separate. I've got more of a space between my second and third toe. I'm not sure what's going on. It hurts on the ball of the foot. It started gradually. I don't remember doing anything. And you'll take an x-ray and you can actually see on the x-ray that the bones are actually splitting apart. There's a Y there between the second and third toes. A Y meaning just a splitting, so it looks like a V shape almost, with the space in between the second and third toes. What's going on with this problem is actually a ligament problem at the second toe joint, the big knuckle there. We call that the metatarsal phalangeal joint. There are ligaments and tendons in this area which balance the joint and keep the toe straight. When there is damage to the bottom of the joint, one of the ligaments can be torn or stretched, or the joint capsule itself can be torn, typically on one side or the other. The toe will drift to the opposite side. It'll drift to the side where the structures are still intact. In essence, that side is pulling and the other side's trying to pull, but it's not able to, so it gets overpowered. There's an imbalance in the soft tissue. So the second toe typically will be injured on the lateral side, or the outside of the foot, closer to the middle toe, which in turn causes the toe to drift towards the big toe. When that happens, it's important that you get this treated quickly, because otherwise it's going to turn into a chronic problem and you'll really have a deformity that's locked in. So the way you treat that, we want to tape that toe straight. You're going to eliminate motion across that joint. Sometimes I will use just simple athletic tape. Sometimes I'll use a little splint that I have to tape the toes together. Sometimes it doesn't matter what you do, it's going to progress anyway. And that's the thing you have to remember with this problem is you need to treat it aggressively. You want to wear stiff-toed shoes, or a surgical shoe. Sometimes I'll even give people a boot, depending on how much pain they're having. But the goal of treatment would be to get the soft tissue to heal up on its own and form scar tissue in there, and try to maintain the position that it's in. You're probably not going to correct it and straighten the toe with just doing the conservative treatments in the office. But if you can get it to heal in that position and not progress, then you can live with it in most cases. If it does progress, it goes on to where you actually need surgery. And there's people that advocate surgery from the start, which is not a bad option. But you have to go in and physically repair the soft tissue. You repair either the joint capsule tear, you repair the ligament that's involved, and then sometimes you have to look at the other predisposing factors. Oftentimes this is caused from a long second metatarsal bone. The bones in the foot should have what we call a parabola, meaning the first metatarsal should be the biggest and the longest. Oftentimes, people who have this problem, the second metatarsal is a little bit longer. So people will put more weight on that longer bone, and over time that will just wear on that soft tissue and cause it to tear. So sometimes when we treat this, not only do we repair the soft tissue, but we will shorten that bone to try to restore normal weight bearing and take pressure off of that joint to prevent this from recurring. So there's definitely treatment options with crossover toe, but it's something you need to address early on to have a better result, which will involve not having surgery, which is what most people's goal is. And I certainly do have lots of patients that have had this problem and have not required surgery and done very well. But there's certainly a number of people that do need surgery, and they also will most of the time have a very good result. There are times when the damage is so far done that arthritis will start to develop in that joint, and even after surgically repairing that and shortening the bone, you still have some arthritis in there, so people will still get pain or degeneration in the joint. So it's something I'd recommend you get addressed early. Go see your doctor, see your podiatrist. We're happy to see you.